not going to support your lifestyle. It's not going to support your liabilities. You're going to have a lot of stress. So we need to be, as dentists, we need to be focused on the business aspect just as much as we focus on the clinical treatment. But the million-dollar question is how to be successful. Personally, I was not always successful. Now I run a successful practice in Beverly Hills. I'm a periodontist, an implant specialist. Together with Rashad, we founded Surgical Master. It's one of the biggest surgical training platforms online, with thousands of doctors inside our mentorship programs, with millions of views online. And I do have the clinical experience, the education experience, and the authority to be sharing with you clinical advice and business advice about dentistry. But I didn't always start like that. When I started, I was like a deer in headlights. I didn't know anything about business. I was just starting to hone my own skills as a periodontist. And I called myself a frightened little boy. I didn't really know what I didn't know. And things were not great until I started to get financial advice. I learned a lot on the job. I learned a lot from mentors, from partners, from financial advisors, and from self-education. But things were not always that great. And I've been on both sides of the fence of success. I was not always successful. And I come from a point of view where I learned the lessons, and I also systematize these teachings so I can convey them to you in a very simple and concise way. So if you right now don't feel very confident about the business of dentistry or the business of surgery, by the way, I'm not, the world's expert, one of the world's experts in business. That's not my claim to fame. But I learned a lot. And I think in a 60-minute webinar, you can pick a few things that will help you tomorrow in your practice. So your participation today is going to be well worth it. I learned a lot from the systems that were developed in my practice that has been around for 40 years in different iterations with developments. We recently upgraded our office. We expanded, we're growing, we incorporated technology. And we have a lot of systems that help us be profitable. And I'm going to share some of them in this webinar today. So what I learned is that step number one, if you want to be successful in the business of perio surgery, you need to know your numbers. It's a must. You need to know the expenses. You need to know the overhead. You need to understand your profitability currently. You need to know your overhead per hour, your production per hour. You need to know all of the numbers that may sound boring and may sound something like you want to have the accountant deal with it, but it's really on you to understand and implement. Step number two, you need to understand the principles of profitability. You need some business education and guidance, some of which you'll get today. And I encourage you to keep learning and keep expanding your knowledge, because there's really no end to learning. Step number three, once you understand numbers and profitability, you need to have a certain operational system, or a treatment system in your office where you can utilize these numbers, you can utilize your knowledge about profitability, and that is going to be a self-feeding loop. So you can now understand more about how your business is doing, and you can make the necessary corrections to grow. And that's really what changed the trajectory of my career. So for us to understand what is really the exact profitability in perio, what are the different buckets that we can make profit in? So I identified 5 profitability buckets in perio. The number one is to do a proper exam, to do proper testing, like bacterial DNA testing, radiographs, optical scanning, CT scanning, panorexis. All the testing that is done in the first appointment is a profit center in itself. It's not huge, but it's very important. A lot of doctors give this part away. By the way, you're screening for bad patients, for the wrong patients to come to you. I don't want to say bad patients. So that's bucket number one. Bucket number two is your non-surgical treatment. Bucket number 3 is the actual surgery that is extremely profitable. And then we have maintenance. We call it the recurring profits. You have patients in your hygiene program that come in, at least 4 times a year, and that's a recurring revenue for your practice if you have an A+ hygiene program. Now, the fifth bucket that many dentists don't think about is retreatment. Your perio patients are going to have relapse. They're going to have breakdown. That's just the nature of the beast. That's perio disease. It's going to get better. It's going to get worse. When it gets worse, they will need to have retreatments, redoing of non-surgical, surgical, more maintenance, more materials, more procedures. And that's also part of the recurring. And that's actually very huge for the life of the patient, of your patients. They will have more and more treatment that they will be needing. Now, the bottom line is it comes down to awareness, to being aware and not misdiagnosing or underdiagnosing. Rashad here with us, in the past week, since we introduced the Perio program, since he's been connected to the Perio, listening to the teachings as a general dentist, he already diagnosed at least 5 cases. I think he's doing one right now under IV sedation. So being aware is very helpful. You know what you know. If you don't know that there is that option, you're going to either misdiagnose or not diagnose at all. And that's what we call an opportunity loss. I'm going to talk about it in the training. Now, last week, we talked about the formula of perio surgery. Interestingly, when it comes to learning a technique and learning how to do things, we had thousands of doctors that registered. I'm talking multiple thousands. When it comes to learning how to do the business, how to make money off this procedure, and how to be profitable, we still had a lot, but we had hundreds. Well, not everybody can be successful. Not every, and it starts with a want. You can be successful, but if you don't educate yourself, if you don't invest in business education, then you're not going to be that successful person. So just to show you that not everybody is going to really focus on the business aspect of it. And we have that experience, because remember that you have an expiration date. We all do. I'm 50 years old. I don't know, I probably have another 20 years in me, knock on wood, but we don't know. At some point, we're going to expire. If you're going to work at a low profitability, it means that you'll have to work more years. It means that you'll have to do more procedures. That is going to create wear and tear on your body and on your mind. The dentistry is pretty daunting and pretty stressful. So what you want to do, you want to be as profitable as you can. You want to do as many procedures that are profitable, and to do the least procedures that are not profitable, and assign them out, or make sure that you're profitable, because you're going to expire no matter what. I want you to expire in good shape and be very happy about what you do. It's much more enjoyable to practice when you are doing well financially. So how do dentists fail? What are the 10 financial mistakes dentists make? Number 1, 3, 4, 5, 6, 7, 8, 9, 10. I think I need to stop this presentation for a second so I can show you what those numbers are. Sorry about that. There you go. Okay, so what are those 10? What are those 10 mistakes? Number 1, you need to know the numbers. If you don't know the numbers, you are just blind, and you're just lost. You're drowning in water. You just don't know where you're at. You need to understand the numbers behind your business. Number 1. Number 2, many dentists undercharge for surgery, putting all this effort, providing great treatment for their patients, but they undercharge. Second, accepting the hygiene department as a loss leader. If you accept it as a loss leader and you're just building on diagnosing dentistry, well, what if you don't diagnose? That's a loss. You're not going to always diagnose more treatment during hygiene. And my recommendation is don't provide any treatment in your practice if it's not profitable. You're going to have expenses no matter what. You're going to have losses no matter what. You're going to have things where you're like, my God, I just lost $10,000 today. And that's okay. That's part of running a business. You need to identify where you're losing and not repeat those problems. But that's going to be part of any business. Don't intentionally create a part of your practice or create a section in your practice that is a loss leader by intention. It's just not a smart thing to do business-wise, okay? You're not going to see it in any profession in the world, okay? If you're uncomfortable speaking about money, you're going to have less of it. And I'm going to talk about it in the profession. I'm going to talk about it in the webinar. There are a lot of misconceptions about talking about money as a doctor. If you have a flawed financial administration process, your practice does not collect in the right timing, or doesn't have a high collection percentage, I'd like you to reach 99 to 100% collection. I know it sounds a lot, but it's possible to do. That's going to be hurting your bottom line. If you're ordering materials in bulk just to get a good deal, and you let those materials expire, well, you just have expensive materials that you paid for, and you're not going to be using them, and they're taking space on the shelf, and heaven forbid, then you're forced to use expired material, which I don't recommend. That's a big mistake. You have a patient that wants treatment, but you don't follow up with the patient in a timely way. The patient gets upset, loses the confidence, goes somewhere else. So sometimes it's about the administration, making sure that the patients get a follow-up by your team to get them scheduled. Not scheduling for production. A lot of us dentists, and we didn't learn this in dental school. I learned this luckily, close to 20 years ago. When you have a schedule in your practice, most dentists just, wherever we have time and room, we just put the patient in. Is it a surgery, new patient, a filling, a crown, an implant? No matter what, just fill the schedule. Fill the schedule. I don't want to see any holes. And that's okay, but that's very reactive, number one. Number two, it's not intentional about making money. If you want to have a certain production per week, a certain production per month, and then obviously per year, depending on your production goals for the year, and you all should have a production goal, then you need to schedule for production. What does that mean? It means that on your schedule, you have slots for surgeries, you have slots for exams, slots for post-ops, for restorative work, for implant work, for endo, whatever you do in your practice, you want to schedule for production. So you will see on your schedule, and we've done it since even before we were automated on a computerized system. We had the book, and there were, green was for surgery, red was for exams, etc. And this is how you're going to be more profitable. A big one, and it's a big mistake dentists are making, is treating everybody in every case. Whatever comes through the door, I'm going to treat. Whoever comes through the door, no matter what, I'm going to treat, because I have a big ego, or my ego tells me, you're a dentist, you're a doctor, I can handle any patient, any dentist. Or probably worse is I do it because I have to. I need the money. I need the production. I need to cover payroll. Okay, so no, you don't have to treat everybody. You don't have to treat every case. You want to identify those hopeless cases, those red flag cases, those cases where you don't mesh with the patient, where the patient, there's no chemistry, or the patient is not 100% a great patient for your practice. Let them go. You're actually going to make money, because you're going to save yourself headaches, lawsuits, loss of income, and just big trouble. Lastly, and not less important, is dentists fail because they don't have financial guidance. Whether it's a financial planner or money coach, financial coach, or regular meeting with your CPA, having proper bookkeeping, etc. If you don't have any financial guidance, you're going to make big mistakes, and that's going to come out of your own pocket, because everybody else in the practice is going to get paid. You get paid last, right? So I'm going to encourage you to seek financial guidance, whether it's in programs outside of dentistry. With us inside the Perio program, we're heavily teaching the business part of surgery and Perio in specific. And if you can, get the guidance. Okay, so see if you identify anywhere in this list 1 or 2 points that where you can improve upon. So let's start by creating a periosurgery fee. Where are you going to pull this number from? Are you going to make some phone calls? Are you going to call the specialist? Are you going to look things up? Yeah, you're going to look things up if you're part of the ADA. The ADA provides results of a survey where they surveyed different doctors, dentists, general dentists, specialists, how much they charge for different fees. This is where you start, and that fee schedule has, you know, the average the doctors ask, the doctors charge. It has the median. It has the 95th percentile. I want you to be in the 95th if you can, somewhere there where it's highlighted in yellow. And the fees are quite good. We cannot tell you how much to charge, how much I charge. We just don't do that. It's just irrelevant, and it's borderline price fixing. We don't do that type of stuff. But I want to help you and guide you on how to create your surgical fee. This is where I would start. And this is, for example, where the perio procedures are, the osteosurgery, the membrane, the bone graft. By the way, bone graft is per tooth. And that's what doctors charge in the high percentile. So what are the components of a surgical fee? The key word here is itemization. It must be itemized. Don't just give them a one lump sum and then includes the surgery and the bone graft. No, you want to itemize it like a grocery list. Osteosurgery, okay, that's our focus today. What teeth are involved? That's the fee. The bone graft, which teeth are getting the bone graft? Okay, so it's very, very specific. Membrane, are you going to use a membrane? That would be the cost for it. Don't give it away. Are you going to use PRF? I didn't find that in the ADA survey, but figure out the fee for the PRF so you have an idea. So let's just go through some numbers. Osteosurgery, let's say a quadrant of osteosurgery with bone regeneration, with a membrane, with PRF, Emdogain, you name it. So according to the ADA, the 95th percentile, this is the fee for the quadrant. And it involves, just as an example, 4 teeth, 18 to 21. Let's say use 2 bone grafts on 2 teeth. So that's going to be the total, 927 times 2. You're going to use a membrane. That's the average fee in the 95th percentile. Not the average, it's the 95th percentile of what was charged. The average is much lower than that, obviously. And I didn't find it in the ADA, but let's say PRF or Emdogain, $700, and that amounts to, you know, a pretty, you know, mid 4-figure number for a periosurgery that takes about 2 hours. You know, very profitable, and you're also taking into account the overhead of the materials, which I'm still going to be talking about. Okay, so this is where you start. Start with the ADA fee, for example. Remember that you are delivering a high quality service. If you're delivering a high quality service, you're going to have high appreciation and goodwill from your patient, and this is going to lead to high compensation. You can't be charging high fees and you can't understand profitability and be an expert in that without the component of being an excellent operator. And that includes the, you know, how you manage the patient, how you talk to the patient, and the whole patient experience. That falls under the same umbrella. You have to have a high quality product. In the Perio program, inside module number 4, where we talk about periosurgery, we're going to show you the profitability of periosurgery, how to guide you exactly on your fee creation in your practice in the different scenarios. I just gave you a generalized example. I'm going to show you also how to administer the procedure from, you know, the front desk point of view, the consent forms, the prescriptions, the payments, etc. I'm going to go in depth inside the Perio program to get into that, because my goal is not just to teach you how to do surgery, you know, at the top level, but I want you to be charging at the top level and be, you know, profitable and happy about it. How about materials? What's the overhead on materials? it's hard to, kind of get the exact cost depending on what company you're using, how much you're buying. Sometimes we get a bulk discount, etc. But use high quality materials. You don't want to be, be cheap on that end, because I'm going to show you how much you need to charge more or less in proportionate, because you're going to have multiple materials that you're going to be using for your procedures, like bone grafts, like membranes, PRF, EDTA, Emdogain. You're going to be using Gore-Tex sutures, so you need to know the cost, the rough cost. By the way, Gore-Tex is about $12 a suture. So these sutures are the most costly, but you need them for that procedure. Now, a common mistake dentists are making, they buy in bulk, and they end up with expired materials. That's like, take the money, burn it, throw it out the window, and that's a horrible feeling. I hate wasting money, and I hate being wasteful. Losses are going to happen. There's no way around it. That's business. That's the cost of doing business. Your assistant is going to make a mistake. You're going to make a mistake. You're going to drop the membrane on the floor, and there you go, $200. It's going to happen, but let's be mindful of our inventory. There's ways to run inventory efficiently. I'll talk about it in the Perio program, so you don't have expired material. This is a rough cost of bone graft. 2 cc's of bone graft is more or less $200. Yes, you can get it cheaper. Yes, you can get it, branded in, from one of the, more common, more famous companies. Use a reputable source, because think about it. Your patients are going to want a brand name. And, I prefer that. Collagen, about $200 for, a small membrane. Emdogain is costly. Don't buy too much of it. It expires after about a year. It needs to be refrigerated. So you need to have some room in your fridge. EDTA is a very small expense. So all these materials have more or less a cost. Now, many doctors, when they quote a fee for a surgery and they quote the bone graft separately, like I recommend, they quote what it costs them, because they're kind of transferring the cost to the patient. But that's not right. You should be charging at least double the cost to get to break even, because when you're buying materials, that's not pure profit. You need to store this material. You need to spend time on the phone. You have some buying power because you're spending a lot of money with a supplier. So if you just charge the cost, even up to double, you're kind of breaking even on the material. You need to charge a little bit more, in my opinion. Okay. Now, we have an idea about creating the fee, and we have an idea about, the cost of some of the material overhead, but how do you collect the fee from your patient? How does it work in your practice? Think about it. And I'm just going to talk about, traditionally. Traditionally, the dentist presents the findings and talks about the treatment plan, answers questions. Then we hand it off to the treatment coordinator. We leave the room, all smiles, see you at the procedure. Then the treatment coordinator is going to start the administrative process, is going to talk about consents, financial commitments, etc. It should be different. And I changed everything around. I still present the finding in the treatment plan and answer questions, but I also talk about the ballpark costs. Yes, the doctor, in my opinion, in my recommendation, should talk about the cost. And you're going to feel very uncomfortable initially. And I get it. And I felt the same way. When I quoted the cost for the first time to my patient, I thought the earth will open its... something's going to happen. I'm going to fall into an abyss. And I get swallowed in the earth. And something bad is going to happen. You know what? Nothing happened. Actually, yes. The patient said, thank you for telling me. It's a costly procedure. I appreciate it. I need to prepare for that. And I need to be able to afford it. But thank you so much for giving me the ballpark. But when you talk about your fees, and you can just give the ballpark, you don't have to talk about the dollars and cents. It means that you're confident about your fees. It means that you have done this before. It means that you have a certain value that you stand behind, and not just hiding, running away. And there's nothing wrong if you're doing it right now, and there's no shame in it, because I did the same until I had the revelation and the exposure to other doctors that have been doing this and understanding that this is the way, when you present your own fees, it's a positive thing. It's a positive thing. And then when you hand off to the treatment coordinator, it's not a shock. The coordinator has a much easier time, and everybody is happy around that process. Extremely important. Now, you do the surgery, you do the case presentation, you do the diagnosis, you talk about fees. You don't do the collection. You don't take their credit card and you swipe it yourself, or take their check, put in your pocket, or go to the bank. You don't do that. There's a whole collection system that you need to have. You need to have an embezzlement prevention system in your practice, whether it includes cameras, systems in your practice where you check, the money that came in, make sure that it was actually charged to the right credit card, to the right account. There's a whole, art and systems behind it. But when it comes to collections, here are some options. Okay, here are the options. I kind of list all of them here. You can pay in full, or the patient can pay in full the day of the procedure. They can pay in full before the procedure, 1 to 2 weeks before. That's great. Or they can pay in full to schedule, meaning when you have them on the phone or in the chair, they want to schedule, great. So that would be the fee for the procedure. You collect now, before. You collect to schedule. Or you can give them a payment plan. First payment before the procedure, let's say 50%, and the rest after. Or whatever payment plan you want to come up with. Or start the payment plan the day of the procedure. These are the options. What's the best option for you? Take a look at this list. What is the worst option for you? I mean, obviously the worst is not to get paid at all. Like the patient is stiffing you, is not paying, or you're doing it for free. That's the worst option. I'm not even going to put this in the list because it's not an option unless you're doing a pro bono charity case, which we all do every once in a while. Obviously, the best option is paying full to schedule. That means that patient pays, great, they paid up. Now you schedule the procedure. They don't have to think about payment anymore. The worst procedure the worst process out of this list is a payment plan when you start the day off, meaning the surgery was done, successful, bye-bye, post-op instructions, and then the payment plan starts. You know what? Problem is gone already. The problem is gone. The problem was treated. Well, the patient doesn't matter. The site is healing already. The bone graft is healing, is in the process of healing. Well, he's not going to take it out. Well, I'm going to pay whenever I'm going to pay. And I'm not saying this is how patient work, but why would you want to put it to the test? And by the way, there's no right or wrong here. And what works for you. But I can tell you that you need to have, for surgical procedures, and it's very acceptable to have some type of patient commitment. The patient needs to commit. The patient has to have what we call skin in the game, meaning they invested. For example, some patients, when we ask them to pay, and it's very rare, they say, you know what, I don't know. I mean, I can pay you, but I don't know if I'm going to be available, be able to schedule it. I don't want to lose my deposit. So we say, no problem. Whenever you know your schedule, let us know, and we'll schedule you once payment has been rendered. I definitely feel and believe strongly that for surgery, you need to have a certain significant deposit towards the surgery, not less than 50%, and if possible, 100% to schedule the procedure so the patient has a commitment and some type of skin in the game. Because if there's no patient commitment, what if you have an empty chair? I'm not trying to sell you on this process. I'm just trying to tell you this is what I do, and it's very beneficial. But if you want to talk to your team about it, why should the financial commitment be completed before the procedure? Because it's going to minimize your no-show scenario. We have no shows. We all do. Well, it's going to minimize that because the patient is already invested. They're not going to just not show up because they have like another meeting or business opportunity. They're committed to that day. And there's force majeure. They can get hospitalized. They can, somebody can get a heart attack or get into an accident and they can't show up. That's a different story. But if you have a commitment by the patient, it's going to minimize your no-show. By the way, patients will have to pay no matter what. Why does it matter if they pay before, or the day off, the full amount, or after. It doesn't matter. They're going to pay that amount. It's like when you get a bill for, from the cable company or your cell phone bill, pay it now. Doesn't matter if you're going to pay it tomorrow. Your money is not going to accumulate that much interest keeping the money in your account. We're not getting that much interest anyhow in a checking account. And that money comes from checking. Your patients will have to pay it anyhow. Pay it now and make sure that everybody is happy about it. Now, when the financial arrangement has been set already and the patient's paid up, after the surgery, they just walk home. Get the post-op instructions, they get walk home, they get picked up, and bye-bye. They don't have to stop at the front desk. That's ideal. They don't have to think about, swiping the credit card while they're sedated. Get the patient commitment before, whether it's paid in full to schedule, paid in full before, 50% before, 50% the day off. I'm fine with that. Just don't leave it to luck. Don't leave it to chance, because you don't want to have an empty chair. There's nothing more sad than an empty chair that you had a scheduled surgery and scheduled production for. It's a beautiful chair, but it's empty. So what if they don't show up? How to deal with a no-show? There are different ways to deal with it, but my analogy is the plane ticket, the seat was paid for already. When you go on a plane, plan a trip, the seat was paid for already. If you didn't show up, the plane took off, you're not going to get a refund. They're not going to be able to sell that seat. I'm not going to be able to sell that seat either. I'm not, if they didn't show the day off, I can't call somebody up and offer a surgery. It's just not, it doesn't work like that. So we created some contingencies in our practice. And in our consent forms, we also include the fee for the procedure. We also include an area where the patient initials that 20% of the fee will be forfeited if the appointment is canceled within 5 days, because we won't be able to schedule another patient in that time. I think it's fair. And if it's more fair to you to do 50, or if they paid in full and they never showed up, you could be very nice and maybe apply 50% towards the next procedure. But you should not be screwed because somebody did not show up. Now, if there's a force majeure, somebody got a heart attack, somebody passed away and didn't show up, well, give the money back. They have other problems. But you're a business person. You're a dentist, you're a doctor, you're providing high quality treatment with liability, you have expenses, you have overhead, you just booked a couple of hours for a procedure and it was canceled. And things are going to happen, but I want you to be protected. So use your judgment in how you handle things. Now, what if a patient is late for surgery? Late show? It happens. We live in LA, there's a lot of traffic. Well, I always book an extra hour. I always book an extra hour for every surgery because I know that I'm going to either need this hour, I'm not going to need this hour. I'm going to do other things. I have time for complications. So I built in the extra hour, I have time for the late show. If they're 15, 20 minutes late, great. Not a big deal. It's not going to affect me. I usually overestimate how much time it's going to take just by design, because that's my system. If they're late 2 hours and there's only half an hour left in the procedure, well, it's like a no-show. We don't even start. We actually call the patient, don't even show up in a nice way. Don't show up because the doctor's not going to have time to complete the procedure. And then you apply the no-show protocol, okay? How about hygiene? What's the deal? No-show, late show. Actually, with hygiene, it's very simple. The late show, if they show up late, do the best you can. They showed up half an hour late, we got a half an hour remaining. You know what? We'll do the best we can. We'll do a growth scale. We'll focus on one region. We'll reschedule you. We'll do the other side next time. We'll do the best we can within the time frame. But there's a full charge for that appointment. If they don't show up, there's a full charge because the plane took off. The seat was bought already. There's no other patient that is going to come for hygiene in a minute's notice. Not going to happen. The hygienist gets paid no matter what, her or his hourly fee. The overhead for the practice stays the same. The materials and the trays and the instruments that were opened up and need to be re-sterilized, there's an extra, there's a fee for that. There's a cost for that. There's tons of things, plus the plant production for this day, that's a loss. So a no-show is a full charge. And I know it takes a little bit of courage. I know some patients are going to get pissed because they couldn't make it. Their kid was sick and they had a business meeting that they couldn't miss, and they were late from another commitment, or there was an accident on the freeway and they couldn't show up. I feel for you. I'm sorry. I'm sorry it didn't show up. And I'm sorry it was very hard, but for today's appointment, there's going to be a full charge. Now, if it's a patient of 30 years and somebody who you know personally to be like one of the best patients ever, and he or she are so great, and you want to be the nice guy, nice lady, or the nice doctor, okay, so let it go. Don't charge them and tell them, next time there's going to be a full charge. That's okay. We want to send them a letter that next time. I find, keep it simple. This is one of those scenarios where it's black and white. We're not talking thousands of dollars. If you don't show up to your shrink appointment, you get charged. If you don't show up to your I don't want to say nails, because nails is like just show up and get the work done. You don't show to your hairdresser's appointment, or to your tutor's appointment, or your coach, your personal coach, you'll get charged. It's just like, why are we different in dentistry? Remember, the seat was bought already and the plane took off. We can't sell that seat anymore. And I hope this alone is going to be applicable to you. And I'm empowering you to use that methodology as well in your practice. You're not going to regret it. Talking more about how to deal with patients no-show, late patients, how to make your practice scheduling more profitable in hygiene. I'm going to talk about in the Perio program in module number 5, where I'm going to be teaching you how to build an A+ hygiene department like a periodontist, and specifically talk about the numbers. You must know the numbers. Talk about the hygienist salary, the percentage of the hygienist salary, the proportion between what he or she makes and what he or she produces in hygiene, and learning the right percentages. Very important for profitability. You need to know that. You need to know how to handle the no-shows, the late patients. I'm going to talk about, also how to interview your hygienist, find the right one, how to maximize the profit from hygiene and make it thriving. We call it A+ in our company. So I'm going to talk about it inside the Perio program. Now, a lot of doctors don't feel comfortable talking about money in front of patients, because I'm a doctor. I should be like clean. Well, money is not dirty, by the way. Money is very clean, okay? Extremely. Especially the brand new bills. They're very lovely to touch. So don't feel bad. I felt the same way in the past. We were scared, or we are scared, that patients will think that I'm money hungry. We got to change our mindset. Talking about money, talking about treatment, even myself talking to you about the cost of our tuition when you join our courses. I don't think you see any embarrassment or anything like that. I feel like our courses are high quality and they move the needle for a lot of doctors, and you can benefit. And I feel very comfortable and confident talking about the fees that are just a fraction of the value that you're getting if you join our courses. So I'm empowering you to talk about money with your patient. You're going to have a little bit of butterflies, and you're going to have a little bit of palpitations and trepidations, and you name it. You're going to think the worst thing is going to happen when you're going to say the word money or mention dollars and cents. But in reality, you're going to look more confident, and you're going to have your patient appreciation, and they're going to say, thank you, doctor. I appreciate you telling me about this aspect. It's very important. I may need to figure out how to do this. It's quite costly, but I will do it because you presented it so nicely and so logically, and I get it. I need that work, and I'm going to find a way to afford that. Now, do you know what's one of your biggest costs? The biggest costs, and there are a lot of costs. We talked about some in this training. The biggest cost is actually a loss. It's the opportunity loss. It's when you lose something that was a potential in your practice. It's the value of a lost potential profit because you didn't realize that potential. Like treating perio in your practice, creating a great hygiene program, like treating perio defects, like diagnosing complex cases, like doing non-surgical treatment, scaling, root planing, like properly diagnosing. This is a great potential. If you don't do it, and you don't have to, but if you don't do it, there's a great opportunity loss that you're not thinking about. And that comes from misdiagnosis. Like if you misdiagnose, that's an opportunity loss. There's a defect there waiting to be treated. If you underdiagnose and you just observe, monitor something that needs to be treated, that's an opportunity loss. That's the value of a certain potential that you didn't realize, you didn't even see. Hopefully in the past 2 webinars, you are much better diagnostician and you are more exposed to the opportunity in perio treatment. We teach diagnosis in module 1 inside the perio program, so you don't misdiagnose, so you don't underdiagnose, so you don't have that opportunity loss in your practice. So I teach you in a very simple way the intuitive diagnosis system. I call them buckets. I have 3 buckets that I use for my own patients. I'm going to show you the workflow and the templates and the checklist that is assigned for each diagnosis, so you don't have to reinvent the wheel. I'm going to show you everything that a periodontist does, everything like a periodontist, like a successful perio practice that has been around for 40 years. All of that is inside the perio program. So step 1, know your numbers, master your numbers. If you don't know your numbers, talk to your advisors, talk to your accountant, talk to your bookkeeper, look at your overhead, look at the P&L, look at the daily reports, look at the monthly reports, and know what numbers are important and what you need to look at. Then understand profitability, and then figure out a treatment system in your practice that takes both into account, and it's a self-feeding loop, because the more you understand numbers, the more you understand profitability, the more you put it to use through an effective system, the more these things are going to rise and be more and more profitable. Because I can't emphasize enough how important it is to have a tight financial operation that is in tune with the business aspect of surgery, of dentistry. Anything that you do should be profitable, because when you have that in place, when you have those systems in place, then you can focus on patient high quality care. And when you have patient high quality care, this is when you're going to get the stellar reputation, the 5-star reviews and the raving fans. And that's a loop that feeds itself. Then you're going to be even more profitable. And when you're more profitable, you can even focus more on patient high quality care and get more patients in. It's the opposite of just a great cycle to be in. It's a cycle that amplifies itself to be excellent in what you do. Now, is the fee schedule the same for osseous surgery around teeth and implants? How do we figure that part out, knowing that it's not the most predictable thing? Creating a fee guide for perio, so you have kind of a menu of products with a fee. How do you deal with consent forms and cost estimate forms? What are the exact forms that you need to use at the top level that covers you from a liability point of view, but also covers you financially? What's the exact workflow that you need to utilize in regards to the handoff? What are the words we say when we hand the patient off to a coordinator, and what's the sequence of events? What if the patient is a rush and needs to leave right now? Do we need to close the deal right now, or can it wait? I'm the type of doctor that is very laid back, and I don't have to close the deal right now or the patient's going to run away, because I believe that what I communicated with the patient and their trust in me and them listening to me and knowing that they need what I'm suggesting, I'm not scared if they leave and didn't schedule and didn't pay, because I know that that left an impact, and we can follow up with them tomorrow, next week. How do you ensure that there's a proper collection system? There's no embezzlement, that nobody swipes the wrong credit card. How do you administer consent, prescriptions, and payments before? And there's a lot of other things that you need to know in regards to the financial aspect of a perio practice. How to charge for biopsies, how to administer and create a profit center that is a non-surgical treatment. A lot of people say, this is really not profitable. Well, Rashad just did a full mouth scaling root planning under IV sedation. That was profitable. How do you create a profitable hygiene program? How do you get what we call a turnkey system with a mentoring resource to help you leverage this Perio opportunity. This is exactly why we created the Perio program, which is a program that gives you the systems and gives you every step to perform effective and profitable Perio treatment, which is on your own patients, on your existing patients in your own practice, so you can create a practice growth center while treating patients with non-elective treatment. That's the Perio opportunity. So the Perio program allows you to replicate the systems of a successful periodontal practice with perio surgery, treating different perio conditions, creating a thriving hygiene program. And all of that with mentorship and support by me, by the whole surgical master team. We've been there, we've done that. My practice has been around for 40 years. You can tap into the same systems that we use in our own practice with our mentorships and with our mentorship and our coaching. And you also be getting 12 AGD PACE CE credits. Now, who's this course for? The course is for dentists that are just beginners, getting started, whether you are owning your own practice or an associate. You can be also experienced, where you have already a hygiene practice that it may not be maximizing its potential right now, maybe a loss leader. I'm telling you again, it should not be a loss leader. Or you have associates that work for you, or you are an associate and you want to up your game in perio diagnosis and treatment. This course is for you, and definitely for dentists that are interested in providing perio surgery, because it's heavy on the perio surgery training. So how did we create this course? How does this work, this course? So we divided it into 6 modules. We deliver it every week, and we keep it short and concise, about 1 hour per each module, plus Q&A. In that hour, I deliver the exact systems and protocols that I use for that topic. For example, we're going to start with a diagnosis like a periodontist. Okay, I'm going to share with you the system. Then we go into treatment planning for success, and we're going to talk about non-surgical perio surgery 101, how to build a successful hygiene practice. We call it the A+ hygiene program. And then how to deal with complex perio cases. And that's the roadmap, and that's the path that I've already walked through, and walking through it every day. I now systematize that knowledge inside the Perio program, and you're going to get the benefits of about 40 years of a perio practice in Beverly Hills that is successful and profitable. You can get the same systems now incorporated inside your practice. We call it the turnkey education. So the exact method a periodontist uses to diagnose and treat, the exact forms, the patient communication frameworks, the fee structure, the business of perio treatment. You got just the gist of it today, and you're going to get mentorship on your own cases. Very comprehensive, very applicable, very simple to do, simple to afford, and to go through. You don't have to travel. You don't have to miss out on your family or your practice. You don't have to jump on a plane, go into a hotel. You can do it from your own home under mentorship. So the Perio program teaches you how to diagnose correctly every time, treat non-elective perio cases, and bring recurring revenue into your practice, just like a periodontist. So the Perio program registration is open today. I'm going to share with you a little bit about what's included in this program. To register, go to perioprogram.com, where you can read more about this program, and you can, of course, register. So module number 1 is dedicated to a winning perio exam and diagnosis. So you don't have to miss out on that opportunity. So you don't have to misdiagnose, be liable to lawsuits, and see patients losing their teeth, and you just being there, not knowing what to do, and being frustrated about the lack of competence and lack of knowledge that you have to treat the very common disease entity, or the most common disease entity in the mouth, not to mention the patient disappointment. So in module number 1, I'm going to talk about the exact records you need. And doctors, I know, we are overwhelmed with so many things in dentistry, and we don't really know what records to take. I'm going to talk to you exactly about how to take the records in a simple way, in a short and concise way, how much to charge for them, how to do bacterial DNA testing, which is very important for the diagnosis. It's actually another profit center in your practice. How I interview the patient, how I build trust with the patient. So you have develop some trust and likability so your patient doesn't look for a second opinion. They found their doctor with you. I'm going to share with you the exact formula of how I diagnose a patient, those 3 buckets. That's the intuitive system that I'm going to be sharing with you, so you don't have to get confused and not be clear when it comes to treatment, because treatment is dependent on diagnosis. And I'm going to share with you the exact patient communication framework so you too can be successful in how you communicate, so you communicate with clarity and with confidence, so your patients can go for the treatment. And then I'm going to share with you the workflow templates and the checklists to go with each diagnosis, so you can just basically fill in the blanks and hand off the patient to the treatment coordinator. And I'm going to share with you the system so you don't have to be confused between inflammatory conditions that are plaque-induced or autoimmune conditions and all the things that are now perhaps confusing to you. This is what I'm going to share with you in module number 1, diagnose like a periodontist. In module number 2, I'm going to share with you how to be confident in treatment planning. They put a picture of me here, very confident, but I'm going to share with you true confidence, because confidence comes from knowledge, and confidence will come later on from experience as you start treating cases or patients with Perio disease and start providing the different Perio modalities, non-surgical and surgical. It all starts with a treatment plan, and treatment plans may sound confusing, so I'm going to dumb it down for you. In 1 hour, I'm going to share with you the system of treatment planning in Perio. I'm going to give you a template for each diagnosis. I'm going to share with you the exact sequence and the interval between the steps, because that's important for the success of the treatment. So you don't have to just guess and do whatever, because there is a system, and I'm going to share the exact system that I use in my practice. Then I'm going to share with you the exact checklist that I'm using in my practice. I have it here. That checklist I'm going to share with you and show you that I fill this out, hand it over to the treatment coordinator, and she takes over, and she will then turn this into a collection system, into a patient in a chair waiting for surgery. So that checklist will be shared with you. Then I'm going to share with you the guide for the fee schedule, the exact consent forms, and the estimates that we're sharing with our patients directly from my own practice, and share the exact administration workflow to schedule and collect payment. And then how do we prepare for surgery? This is the prescription, the prescriptions that we're going to be calling in, the other accommodations before surgery. That's all in module 2. Okay. So module 2 is about preparation for treatment. Module 3 is, module 3 is about preparation for treatment. And we're going to talk about non-surgical treatment. The elements of a successful SRP, what's inside the hygiene kit that we use in a perio practice. What type of machines do we use? What is the setting on each machine, the piezo, the cavitron, the cavajet, etc. How much time to allocate for each session? The profitability and fee structure to ensure collection. Patient communication systems. What type of sedation we're going to use for any type of surgery? What are the how to set up a reevaluation, and how does non-surgical treatment work? Module 4 is all about surgery, how to do, we call it Perio surgery 101, like a periodontist, how to do surgery at the level of the periodontist, and it all starts with the exact surgical protocol. I'm going to share that with you. How we communicate, the exact words that I use for my patients, so you can be confident. You don't have to reinvent the wheel. You get all the resources ahead of time, and you can then communicate to your patients, and you can get those procedures scheduled. I'm going to talk about the instruments, the surgical kit, the bone grafts, the membranes in great detail. I'm going to identify for you the surgeries where you need to start, the osteosurgery that you want to start with, and share with you all the different scenarios of osseous surgery that are out there, the different bone procedures that we do as periodontists. And then we're going to share the profitability system, guide you on fee creation, the administration process when it comes to surgery, the consent forms, the prescriptions, the payments, and review each instrument in the kit and its function. And of course, the details of the surgery, the flap design, the bone reduction, all the way to the suturing, and how to deal with complications. So it's going to be a pretty heavy module, but I'm going to deliver that module with conviction, with clarity, in a short and in a simple and concise way, so you can understand it, so you can implement. I'm not going to bore you. I'm not going to tell you stories. I'm going to share with you exactly what I do in my practice in about an hour. I'm going to do some Q&A, and you're going to have that module as reference when you do your own surgeries in your practice, so you too can take bone defects and big osseous defects and treat the root and graft bone and be able to apply the perio surgery formula. And you can also apply the business principles of perio treatment and be successful and grow your practice. In module 5, it's all about a profitable and effective hygiene program. And I'm talking about building an A+ hygiene department like a periodontist. Nobody's perfect, but our practice has been around for 41 years. Our hygiene program has been around for 41 years. We have one hygienist that is now 40 years in our practice. What lessons can be learned in 40 years? What information and what knowledge can come out from a practice like myself, like mine, where I took what we're doing in the practice and I systematized it in a simple, in short, bite-sized lessons that you can now implement. So what's in module number 5? I'm going to talk about the new patient indoctrination, about the ideal cleaning schedule, how to shift to a periodontist level hygiene program. Okay, so yes, you are a GP, yes, you may have a different specialty in dentistry, maybe you're even a periodontist watching this training, but I'm going to share with you the exact methods that I use in my practice to have an A+ hygiene program, all the way to how I interview a hygienist. What's the structure, the appointment structure? How long does the appointment take? What's at the beginning, middle, and end of the appointment? How to schedule hygiene for a full year? What's the goal of a hygiene coordinator? How to manage multiple hygienists with confidence. I have 15 days of hygiene in my practice. I have 7 hygienists working in my practice. It's a beehive in here. Let me share with you the system this beehive has. How to be profitable in hygiene. What's the fee structure with hygiene? What's the component of the hygienist's salary versus what he or she produces? That's very important to know these numbers. You got to know your numbers, doctor. How to handle no-shows and late shows. I gave you, just kind of the tip of the iceberg in this training. There's so much to know about that, and I'm going to share all of it with you inside the Perio program. In module 6, we're going to talk about challenging cases. We're not going to start with challenging cases. This is why this is module 6 and not module 1, because as you start practicing, as you start doing more and more cases, as you start getting more knowledgeable, more experienced, more profitable in surgery, you're going to start seeing difficult perio cases and big problems. You need to know how to manage them. You'll also need to know the red flag cases, the ones you don't want to touch. You want to refer them out. There are those as well. All of that is going to be in module number 6, which is basically about the next level treatment for challenging cases. Identify the red flag cases and learn what not to touch. Very important. That's one of the mistakes dentists are making. They're treating every patient and every case comes through the door. Don't do that. You need to identify what you don't want to treat, who you don't want to treat, and what cases you don't want to do. You're going to save a lot of money this way and a lot of headaches, frustrations, and gray hair. I'm going to teach you how to identify the patient profile to better handle complex cases. Very important, because these cases are pretty long, pretty costly, and involve a lot of steps. I'm going to talk to you about chronic conditions like autoimmunity, diabetes, etc. We're going to talk about treating perio in the aesthetic zone that has its own liabilities and problems and challenges and stress. So I'm going to share with you how I manage those. How to manage periodontitis stage 3 and 4, even end-stage dentition. How do we handle that? Not just clinically, but also what's the psychology of the patient? How do we communicate with the patient? Necrotizing conditions, gingival hyperplasia because of medications, treating peri-implantitis and failing implants, retreatment, patients that fail, patients that need to be redone. It's completely different, like revisits, revisions, peri-disease in kids and young adults, how to treat patients that are medically compromised on blood thinners and they take all sorts of medications that are uncontrolled diabetics. How do we handle these cases with safety and with confidence and provide care while protecting ourselves, while being profitable, while keeping our stellar reputation? All of that is going to be in module number 6. And of course, we're going to talk about the fee structure for more complex cases. Guess what? These cases are going to be more costly for the patient. The fee for this procedure, for these types of procedures, is going to be much more significant. So all of that is inside the Perio program. You're going to be getting 12 AGD PACE credits, taking all those modules. The tuition is $3,500 normally. We are now offering for this cohort, for the first doctors that join the Perio program, we are offering the Perio program for a reduced tuition, $1,497, or you can join for $540 in our payment plan, whichever works for you. To register, go to perioprogram.com. You can read about the program. You can read about the testimonials, about the surgical master teaching. You can read about the different modules, and you can then pick your payment plan. You can then enroll, and we look forward to seeing you in the training. It starts November 14th, the first session. By the way, if you can't attend any of those sessions or one of the sessions, all those sessions are going to be recorded, and you'll be able to watch them and participate in our mentorship. Like with all of our programs, we give you a very strong yet simple guarantee. Take the program for 30 days. If for whatever reason it didn't work out for you, not what you thought, or for whatever reason, send an email and you get fully refunded. We don't want anybody in this program that doesn't want to do this work or doesn't want to explore the opportunity of Perio and uncover the untapped potential that many dentists have in their practice. So very simple, we removed all the elements of risk from signing up. Now, when you join the Perio program, for a limited time, you're getting 3 bonuses. The first bonus is extremely valuable and extremely important. It's the monthly coaching show or the mentorship that you are getting. It's going to be a 1-year mentorship in Surgical Master, where you're going to have your questions answered. You're going to have, you'll be able to bring up your cases. You can submit up to 12 cases during the coaching program. You can either go live with us and communicate about the case live. By the way, those sessions are recorded in our posted inside the platform. You can, if you don't want to go live or you can't attend or you don't want your name to be mentioned, you don't want to show up on camera, that's cool. We can give you one-way feedback on your cases. Make sure to watch it though. The value of the monthly coaching is $4,800. You're getting that value, you're getting that mentorship when you join the Perio program. By the way, the mentorship is for 1 year. If you wanted to extend, like many doctors do, you'll be able to extend that as well. So you'll be getting guidance on the cases you're planning to do, guidance on and feedback on the cases that you've done already. The second bonus is the Perio Experts Secrets. And that's basically a training by world-renowned periodontists. I want you to be excellent at anything that you do. And I'm going to share with you inside the Perio program my perspective on how I run a Perio practice right here in Beverly Hills with very demanding patients, with a very big referral base in Los Angeles and Beverly Hills. But that's one way to do Perio. And I want you to be enriched and get different perspectives on Perio. So I'm involving world-renowned Perio experts. And for about an hour before our coaching show, we're going to have the Perio Experts series where you're going to get additional knowledge from experts in the field. The value of this bonus is $997. You're getting this bonus when you join the Perio program. Bonus number 3, I'm very excited about. The Surgical Master team did an amazing job in creating the Perio Patient Communication Atlas, especially at the beginning. When you start doing Perio surgery, Perio treatment, you're starting to talk about Perio with patients, you're not going to have your own cases because you're just starting out or you have very few of them. So we created a digital copy of the Perio Atlas for Patient Communication, which is basically like a digital slide deck with all the photos and cases that you're going to encounter inside the Perio opportunity, from simple Perio cases, from just inflammation, to cases needing osseous surgery, to aggressive cases, to stage 4, to pathological lesions, to gum inflammation, to autoimmunity, to gum cancer. I want you to have everything that you'll be seeing inside the atlas, and that's part of how we communicate with the patient. So you're going to be getting this atlas when you join the Perio program. The value of this atlas is $497. You're getting it included in the tuition, and it's going to allow you to communicate, and it's going to allow you to show your patients, hey, look, this is a similar situation like yours. And we have the analogy. For example, the team put here a tree with exposed roots and no foundation, just to give the patient a, like a certain feeling about what they have, an analogy of what they have, so things are much easier in communication. So the atlas is just an awesome thing. You'll be getting it when you join the Perio program. Like I said, the Perio program value normally is we're going to work up to that, is $3,500. You'll be getting the monthly coaching. You're going to be you'll get the Perio Expert Series and the Patient Communication Atlas. That's a total value of almost $10,000. Wow. You'll be getting the Perio program today for $1,497, or you can join today for $540 if you wanted to do the payment plan. It's totally fine. The best value is obviously one payment, but whatever works for you, go to perioprogram.com, learn about the program, and more importantly, enroll, take advantage of our simple guarantee. There's absolutely no risk. You can take the program, you can try it out, you can enjoy and benefit from the teaching. And if you didn't, let us know, and you're fully refunded. If you refund, you're not going to be getting CE credits. You'll be getting them at the end of the program, and you're going to be taking those modules every week. And I'm going to deliver with, in a short and concise way, simple way, each and every one of those topics. You'll be getting handouts. You'll be getting the exact scripts, checklists, forms that I use in my own practice, so you can benefit from it. And it's just a great feedback here from a doctor. The more I see, the more I realize just how much there is to assess pre-op, and how much thought goes into planning and ascertaining the prognosis of what I do. Your videos have definitely changed my practice for the better. So yeah, there's a lot to learn, and you'll be able to binge as well on what we're going to be sharing with you, so you too can look at these cases, so you too can do cases in your practice. If you're going to be treating maybe one case in your practice, one osseous defect, and I showed you in this webinar how to create a fee, the income and the production you're going to generate from that case alone, and you're going to be doing many cases. Obviously, Perio is a very successful treatment. It's very profitable, and patients need it. It's non-elective. If you're going to do one case only, that's going to pay for the tuition, and I think with some change. Some people call it no-brainer. I call it yes-brainer, because the brain is, tells you do it. It's really something that you can afford, you can go through, you have the time. It's a program designed for busy doctors like yourself, and it's designed so the teaching is applicable, so you can get the results that we are promising you under our guidance, under our mentorship. We will be working with you for a full year. You can extend the mentorship as well. and keep submitting cases for as long as you want. Many of our doctors extend their mentorship. The benefit is of no value, and I feel like there's no risk whatsoever because we have a very simple guarantee. And a great feedback from Germany, from you and your team. I get so much information I was searching for, at least for the last 10 years. The personality and your amazing way of teaching is excellent. Thank you so much for the feedback. This is the offer today: the Perio program, the monthly coaching, the expert series, the Atlas, at close to $10,000 of value, now offered at $1,497 or at $540. Encourage you to come and join us. Join the many that already joined. Congratulations to the doctors that are already part of the program here on this training, already joined a week ago. Congrats, because I wanted you to be in this webinar as well, just to give you a taste to the simple teachings that we share with you, to the concise nature of the teaching, not beating around the bush, telling you the way it is in a simple way, and sharing with you best practices from a practice that has been around for 40 years, from a double boarded certified periodontist, that is me, that shares the exact methods that I use in my practice. I'm excited to have the many doctors that joined us already. Join us today. If you didn't, check out the website on the Perio program, simple, perioprogram.com. Everything is there, including the modules, including some testimonials, including the what's included, what are the bonuses like. And of course, you can click and join with a 1-pay or 3-pay. It doesn't really matter as long as you get the knowledge and as long as you implement it. Thank you so much for watching the business of perio surgery today. And I hope it added value to you. We're going to get into some Q&A questions, and I'm excited to to start that program. Our whole team is like amazed by the acceptance and happy to have so many doctors join us already.
Thank you, Ziv. That was very enlightening, and it's nice to know how a periodontist runs things. I mean, at the end of the day, we're general dentists, the majority of us, and as periodontists, you go through more years of training, and it allows you to immerse yourself and to see how someone like you does it, and so we can pick up on things. It's greatly beneficial. There is, however, some people who feel that maybe general dentists are not in a position where they can actually learn perio. I have my own thoughts on that. What's your thoughts when someone says they shouldn't be doing that, or they can't be doing that? If they're like a specialist thinking that the general dentist shouldn't do it. Is it really hurting the specialist when general dentists develop a body of knowledge to diagnose better and treat better? What's your thoughts there?
So undeniably, when a dentist has more knowledge, it creates good in this world. Good for the patient, their patients, good for the doctor who's diagnosing the problem and providing the treatment, and their local specialists. Because the more the dentist diagnoses and the more they see and the more they treat, there are going to be situations where they would want to refer. That's just a reality. Rashad, with all due respect, you're not a periodontist.
I'm not.
But you have two talented hands. You have steady hands. You have common sense, and you have something called a brain. You can look at your patients. Once you have the knowledge, once you have the exposure and the awareness, you can diagnose the patient, and then you can decide, I want to treat him or not treat him. I'm encouraging you to treat him, and you saw what happened this week. You diagnosed about 4 or 5 cases. You're doing a perio case right now, while I'm giving the webinar. I mean, there's no greater proof to that. On a personal level, that's my answer. On a personal level now, it just benefited me from teaching dentists, whether they're in my community or outside the community, the more I taught dentists, the better I did. And yes, a periodontist, that's all we do. We do perio, so probably we do it more efficiently. Maybe some say we do it maybe better, not necessarily so. We have more experience, that's true. But a dentist, once you provide perio treatment, you should not be doing it at a subpar level. You should be doing it at the top level, because that's the standard you're going to be judged at. If things go wrong, did you do it at the level of the specialist? So I'm going to teach you how to do things at the level of a specialist, and then it's up to you to implement and follow the instructions to the T. Don't make up your own rules and improvise, because improvisation is, just in music. Follow things that work. Know the rules before you can break them. And yeah, undeniably, the perio opportunity is here for general dentists. Periodontists obviously do this. We've been doing this for 40 years in our practice, but it's going to increase. It's going to raise everybody. Okay, it's going to raise all ships, right? It's going to raise the dentist. It's going to raise the specialist. It's going to raise the level of care in the community, and everybody's going to benefit from it, especially the patients.
Yeah, I wholeheartedly agree. And initially though, when you think about it, like, oh, a general dentist is gonna do, then I'm losing a case. And I've had a lack mentality. Sometimes I relapse. I have fear or lack mentality about different aspects of my life. But in reality, in the past, week, Ziv, when I started really getting immersed into this perio and developing an eye for it and developing, like, diagnosing better in the course of me and Ziv working together and putting this course out there, I referred, I believe, 5 patients your way. Yes, I can. Yes, I can. Yes, I can treat them. But you know what? I'm busy with other stuff. I'm just so grateful and happy that my eye now is picking things up that previously it didn't. And the same skill set, you and I, we all have that skill set. It's just programming our eye and our mind to think a certain way that a specialist would. And, we all had colleagues in school who are specialists, great guys, fun people, and ladies. We're all dentists at the end of the day. I don't believe we're each other's. I think we're our own, person you should compete with is yourself. And there's other types of industry giants that are entering the dental market. Us dentists, I mean, the more we know, the more we share together, the more we can benefit people out there. So I'm loving it, Ziv. My newfound perio power is real. And the way I'm talking to patients, I'm taking Ziv's language, how he presents things, and I'm talking in a way that builds trust and confidence. Why? Because I built my own trust and confidence first by getting that knowledge, by getting that system. Because frankly, people don't readily share things like Ziv does. And that's the power of the Perio program. Just one of the modules is worth the investment. And it's an incredible, I'm so happy about this program, because let's do needed work and let's get compensated for it.
Totally. And there's no lack. There's no lack. Let's remember that. There's no lack in patients. There's no lack in perio disease. Perio disease is this. I know it's the second most common disease in the world. It's definitely one of the most common things in perio practice. 90% of all people have some degree of perio disease. It's super common. So, guys, nobody's taking food off anybody else's table. It just does. That's not how. There's no lack of patience. If you have a scarcity mindset, then you're gonna have scarcity. That's just the reality. There's a lot to go around. Yeah, there's a couple of very good questions here, Rashad. I wanted to answer a question here from Paul Schaefer. To incentivize pay in full to schedule, do you offer a discount? Example, 3%. So I don't offer that discount because I don't, but the 3% is coming from a very specific place. Some patients ask you, doc, I'm going to pay in cash. Can I get a discount for a cash payment? Then we say, no, guys, everything is reported to the IRS. Medicine is something, there's a medical chart. There's no, everything is clean and legit. But if you pay in cash or with a check, what's the difference? We don't run the credit card. So there's no credit card fee. So it's okay to give the 3%. To me, 3% is kind of petty. I do 5%, to be honest. Just, I don't know, 5 or 10, it has to be like a multiple of 5. But I would incentivize, I don't incentivize, because however you want to pay, but if they say cash or check, you know what, then we don't have to run the credit card. We don't have to pay the commission for the transaction. A question from Adrian. Are your hygiene appointments prepaid? If not, how successful is it collecting for no show? Great question. So hygiene appointments are typically not prepaid. They're not, because we have patients' credit card on file. With our regular patients, when they leave, we charge their credit card. If we don't have it, they didn't show, we charge their credit card, because we have it in a patient consent agreement that every no-show is a full charge for hygiene. Second, if you don't have their credit card, send them a bill. That's a charge. Send them a bill. If they don't want to pay it, then send them another bill with a finance fee a month later. And they don't pay it, they'll pay it, guys. I mean, if they don't pay it, they're not supposed to be in your practice. They're not going to have another appointment. I mean, and we do have some patients that don't pay, over the years, of course, and there's something called collection. Send them to collection over a $200 fee. They're going to pay it right away. Who wants to go to collection for your credit score is going to go down. You're going to pay later on when you want to, buy a car or buy a house. That's going to show up that you were in collection. So it's not, I wouldn't say it's easy, but you send them a bill and they may call and say, I never had the appointment. We know you didn't show up to the appointment and there's a full fee. Oh yeah, I'm sorry, so it's not an issue, guys. And some patients will resent that, and that they're not great patients in your practice. An important question from Dr. Richard Feinberg. The current demands of hygienists for top dollar is way out there over budget. And that's true. That's true. And I wouldn't say way out there, but it's high. It's high because hygienists graduate hygiene school with a thought, I'm going to make whatever amount. I'm going to make $70 an hour. I'm going to make $65 an hour right out of school. That's not up to me. I don't set those expectations, but there's a fair market value for hygiene. And it depends on zip codes. It depends on countries where you practice. But there's an average fee for surgery. It's not made up. There's a certain market value. And yes, it may be a, let's call it an employee market, because sometimes we have not as many employees out there for different reasons. But it's still the market value. So you can tackle it different ways. First of all, you don't have to agree. It doesn't mean that the hygienist that charges, high hourly is better than the one that is, a little bit less. Second, if you need to hire a hygienist with a certain hourly expectation, well, you got to figure out that it's in the budget. And it's not just the budget, it's the percentage of what the hygienist makes compared to what she produces. And there's a magic number there that I'm going to be teaching inside the Perio program, because I want your hygiene program to be profitable and not to be a loss leader. If it's a loss leader, don't do it, because what's the point? If it's a loss leader, wait for the patient at the entrance and just hand them over $100 bill and send them home. Because what's the point in you losing that money when doing the work? You're not going to diagnose dentistry for every hygiene appointment, or at least don't count on that. The hygiene appointment itself has to be profitable, and it has to include the hygienist's salary, hourly salary, your overhead, and the materials.
Clear.
Awesome. Question from Judy Lynn. Judy joined the Perio program. Welcome. Great to have you. You purchased the books, the assistant books with it, and they will be shipped. We have a lot of orders. It can take up to 3 to 4 weeks, depending where you're at. In the United States, it'll be much faster, but Thank you for your patience. You don't need these books to start the program. These books are going to teach you the best practices for a dental assistant. And they were actually written by my own dental assistants of 10, 15, and 25 years in my practice.
Awesome, Ziv. A common dilemma that I face is the patient has, a little calculus. They haven't gotten a cleaning for a while. The hygienist comes in. She tells me, well, they don't really need an SRP. How do you deal with these borderline cases? Where maybe you can clean them without numbing them? Is the determination of what type of treatment, SRP or prophy, is that determined by numbing? Is it determined by amount of time it takes? Because some people, you can do SRPs on them without numbing them up. They just have a high level of tolerance. So can you just give us a little bit more clarity on actually when do you choose SRP? When do you choose like a prophy? And is there any gray area where you can play it so that it's win-win for everyone, and the patient is not getting gypped or the doctor is not getting gypped?
Sure. So SRP, and to me, it's almost like black and white. I know there's a controversy or there's a confusion, Rashad, and everybody watching. It's black or white. If the patient has periodontal pockets, what we call deep pockets over 4 millimeters, with attachment loss, with evidence that there's calculus, and you don't always need that evidence because SRP is effective in closing some of those pockets, they need SRPs. They need it. It's not about you, it's about them, meaning it's not about you if you can do it quickly without hurting them and call it a prophy. If you diagnose deep pockets, and usually there's bone loss, they need SRPs. They may need SRPs on 4 quadrants. They may need them only on 2 or 1. But they will need that. And that appointment, if you want to use best practices, they should be anesthetized. Don't be scared to anesthetize them. A prophy, and to be honest, I'm not sure about what the prophy really means, but in my mind, it means a regular cleaning that does not require local anesthesia. And typically, we're not dealing with deep pockets. And the patient is already inside the maintenance program.
So, Ziv, if you don't detect calculus, then what are you scaling? And there's a deep pocket. If it's clean, there's nothing there. What are we doing?
Great question. So remember, it's called not scaling. It's called scaling and root planing. Your root planing. What does the root planing do? The root planing removes the toxins from the root surface, cleans out the cementum, exposes the collagen, allows for the soft tissue to reattach through something called the long junctional epithelium. It's a type of attachment that happens after scaling and root planing, and after soft tissue grafting, and after perio surgery. So even if you don't have detectable calculus, by the way, the detectable calculus is radiographic, and you don't always see buccolingual, and you don't see burnished calculus. So you're root planing the roots, and you are improving the attachment. You have actually true attachment between the root and the soft tissue. So that's what you're doing.
Clear. And that's very interesting. So what are you concerned with? Is there too much root planing where the patient becomes sensitive and you hear the scalers like screaming from across the hall, or is there too little where you kind of just put the piezo in there, run it across and out? Is there more of a detailed science to this, or
Probably is. I'm not a researcher or academician per se, although I love the academy and I love research. Yeah, I mean, you can overscale a tooth, you can over root plane a tooth, especially lower incisors for years and years and years, and they're going to start looking like an hourglass. It's possible, and it's possible to have sensitivity, and that needs to be treated. the treatment is not always a without side effects, like anything that we do in dentistry or medicine. When you're prepping a tooth for a crown, you're going to create sensitivity. You're going to have some hyperemia inside the pulp. The patient's going to be sensitive for a couple of weeks. Sometimes you need a root canal even. So that's the analogy. Perio treatment will have some side effects, and that's what you're talking about.
Clear.
There's a question here from Dr. Hatamian from Canada. Who's actually, Mo, congratulations on joining the Perio program. Unfortunately, hygienists are not allowed to do that in Ontario, Canada, while other healthcare providers can still charge for late show. Yeah, I don't know. Yeah, every country, you got to follow the rules. We definitely charge for late show because the appointment has been made for the patient, and the late show doesn't mean we're not going to see the patient. We'll see the patient, and we'll do the best that we can within the time allocated. Because if we have half an hour, better to do a half an hour cleaning than nothing. And then if we need to schedule another cleaning to catch up with the full charge, that's okay as well.
Ziv, different countries have different types of laws, and the world of hygienists and perio is mainstream in most major cities in America, and the first world. How do you implement or start awareness and capitalize on the fact that perio and hygiene, they're not something that is routine in a country? Let's say some of our viewers, that mindset that, oh, I have a hygiene department, I have a hygienist. Some dentists even practice without an assistant in different areas of the world. So is there some pearl we can maybe plan to doctors who might be practicing in areas where hygiene and hygienists and perio is more of a exception rather than the mainstream, for them to maybe implement something, and how to talk to people and get them to be on board for it?
Yeah, I mean, the perio treatment is really the one that has the least overhead in the surgical world. How to create awareness amongst the patient? I mean, it's just in your practice. I probably know I'm not understanding the question 100%.
Actually, I have the answer. It's the perio program. Even if you're in a place where there isn't perio mainstream, the way that Ziv shares his system on how he runs his perio office, how he communicates with patients, I don't think that's geographically dependent. It's as long as you're talking to another human being who wants to take care of their health, who has logic, as long as you have x-rays, as long as you understand the disease process and know what to say, then there's a good chance that patient by patient, with your existing patient base, you can start building a great profit center that serves patients. Because in these countries, people don't get their teeth cleaned, let's say every 3 months, every 6 months, maybe a group does. But what I'm trying to say, Ziv, is there's a great opportunity here to push the envelope, to take dentistry globally to another level. While in Beverly Hills, perio treatment, hygiene is the standard, we can all elevate that regardless of where we practice around the world, because it's based on common sense. And that's what I love about how Ziv teaches. He teaches common sense approach that if you know how to communicate it, we are, as dentists, already have the skill set to know how to read x-rays. We know how to probe. We know what diagnosis means. We can extract teeth for the most part. So with your current skill set, you can really set up a great profit center. And it's not veneers and it's not implants. It's treating perio disease. And in a time where there's a recession, where people are holding on to their money more, you're in a good position to really get people to sign up for treatment because you're saving their teeth, versus jumping saying, oh, the extraction and bone graft and implant, where all you needed maybe to do is an open flap debridement over calculus that's been stuck there for 20 years that no one has diagnosed, because no one is looking to diagnose it. But you are going to develop the eye to know how to diagnose this, to know how to communicate it to your patients, to know how to administer it and bear the fruits of that. So I just wanted to share that with you because I touched it firsthand. The Perio, the power of Perio is real, and I don't think it's very underrated. Zeev, you're muted.
So there's a lot to learn. Sorry, I muted myself for a sec. Yeah, I mean, I couldn't agree more. You know, I dedicated my whole career to, you know, studying periodontology. I spent 3 years at the University of Toronto, and you know, I graduated Tel Aviv University in Israel. I actually see one of my instructors here on this webinar, Dr. Weinstock, unbelievable, many years. But the practice of periodontology, and I'm so happy I chose it, is something that is a recession proof. It's something that your patients always want to preserve their teeth. It will always, it's non-elective. It's not like veneers when patients don't have the funds and the budget to do veneers or even implants, they're not going to do it. But if they have a tooth or teeth in jeopardy with periodontal disease, with infections, with various periodontal conditions, they don't really have a choice. So they'll find a way to do it. Plus, it's going to be an ongoing type of treatment. There's going to be some need for retreatment. There's going to be a relapse in their periodontal condition. You'll need to retreat them. They will maybe even eventually lose their teeth and you'll do implants. So the extraction will come at some point. But in the meanwhile, you know, if you're trained in periodontology and you can apply the same principles that I use in my practice, you'll be able to provide that treatment at a very high level. And when it comes to do an implant, but don't wait for the bone to be fully lost. It comes time to do an implant, well, you'll be trained by that as well. We have our implant programs as well. So we're trying to cover all bases for you. I'm lucky because I'm trained in both. I'm a periodontist and an implant specialist, which is just, you know, I enjoy that. And what I love the most is education. I love teaching and sharing what I do in my practice.
Thank God, man. Thank God you love education.
I do. Great. So let's go do some more questions, some last Q&As. And, you know, we have just a big weekend to enroll all the many doctors. We're closing registration on Sunday at midnight. A lot of doctors wait for the last minute, and that's cool. That's kind of human nature. But I encourage you, register before. I want you to register and block the first date on your schedule so you can attend the program live with us, so you can benefit immediately and implement immediately. And we'll also provide you with all the other dates for the program. Block those off as well. If you have some conflict of, you know, scheduling, then it's recorded and you'll be able to see it later. Or cancel the other thing. Attend the Perio program. Okay, that's something that, you know, you can immediately translate into results. What I promised to you, that's something that was critical when we formed this program, is that I need to deliver the content for the topic of the training in 1 hour. That means that it's going to be military, short and concise. I'll spend time as much as you want for Q&A. And we have our coaching show, our mentorship. We have the expert series where you can learn more. But for the exact modules, I'm going to keep it very short and concise. And I'm going to show you exactly. For example, the first module is about the easy diagnosis. I'm going to tell you exactly what I do from the moment the patient walks in the practice to the moment that he or she leaves. From the records I'm taking to the script, the exact script that I talk to them about, the examination checklist, to what I do in that appointment, the exact communication after, how I explain things, and how I reach the diagnosis. And I think you're going to benefit from it. And plus, another requirement is that every module is going to be translated into an actionable plan in your practice, plus a profit center. You will know exactly what module 1 equals in terms of profit and production for your practice. How much you charge, that's up to you. But we're going to make sure that this is applicable and profitable, because these are the two things that are important. You need to be a doctor providing good treatment, plus you need to be a good business person. And we want to provide both in the program.
And it's incredible. It's things we all know how to do, the simple things that you say, oh, it's just a cleaning. Well, there's a little bit more than just a cleaning. If you approach it like just a cleaning without proper diagnosis, that's what I've been learning, you really miss the opportunity. And that's how teeth have 50% bone loss, and then they're discovered because an abscess blows. Well, why not prevent that before that happens? That's why a lot of teeth also are extracted. There's an abscess, and there's no thought to, maybe I can do an open flap, remove that tartar, and you know. All right, Zeeb, thank you so much.
Awesome.
And I look forward to being part of the Perio program.
I love it. So again, welcome to the many doctors that joined during this webinar, and the many doctors that are, will join us. Congrats, Dr. Daniel C, Dr. Chitra Shanmugam. I hope I pronounced it properly. Many doctors are joining us as we speak. perioprogram.com. Rashad and I are going to go back home to our wives and our kids, and we worked very hard this week to launch the Perio program. We'll keep working hard for the next couple days until we make sure that we can accommodate all the doctors. Make sure to join us before Sunday night. perioprogram.com. Take advantage of the program, the valuable bonuses, the 12 CE credits, and the transformation that you will have taking this program and implementing it in your practice, providing that value, the same value of a Perio practice to your patients, plus having the feeling of joy and fulfillment that you're doing things at the top level, plus the growth, plus the profitability, and plus the peace of mind that you're not misdiagnosing or not diagnosing things that should be diagnosed, and keeping you free from lawsuits. So I can't say enough how important Perio surgery is. I can't say enough how applicable that material is. We created a program that is easy to do. It's easy to afford. You can choose a 1-pay. You can choose a 3-pay. No matter what, one small procedure like that, seeing in front of you, is going to pay for the cost of the program with change. And if you didn't like it, you can enjoy the guarantee. We have no problems. If you didn't like it, just let us know. You get fully refunded. There's no element of risk whatsoever. One program, 3 bonuses, great value. The Surgical Master Perio program. Welcome.
Thank you, Zeeb.
Take care, everybody. Good night.